everyone. My name is Dr. Esmaili, your host. I'm bringing in this podcast amazing information about how to decode your own health and make the journey of discovering what your body needs to become healthier and staying away from as much medications as we possibly can. Today, I have the pleasure of doing this podcast with Kirk Huntsman, the CEO of Vivos Therapeutics, the company that I've had the pleasure of working with for the last 3 years. And we want to learn a little bit about this company. And also, we have so much that we're going to talk about. I hope that you enjoyed this podcast. Hi, Kirk. How are you?
Hi, good, Dr. Bahar. Thank you for having me.
Thank you for agreeing to be one of my first guests on this podcast, because I think you have a profound message that I personally share in your journey. And I think there are a lot of people out there who want to know about Vivos, or just about who are we. So I'll let you just take the microphone and share your story, because I want us to hear about it.
Sure, thank you. Well, for me, my journey in this industry started about 10 years ago, a little over 10 years ago, when I was first introduced to the idea that the human airway is a big deal. And it's for a lot of people, it's impacting their health and their wellness. For a lot of our children, actually the first exposure I had to this as being a problem was where I learned about what's going on with our kids. And when I realized and became aware of just how many children are suffering from a sleep and breathing disorder that's going undiagnosed and untreated, and then growing up with them into, or going along for the ride into adulthood, it became readily apparent that there was a huge gap of knowledge, of information, of therapies, of and parents and children are running around trying to find answers, and nobody really had good answers for them. And all of that struck me as really odd in a modern era when we think we have the world conquered and we've got so many diseases that are either under control or that we have, a pretty good handle on. To have such a big gap of awareness where pediatricians or physicians, they just don't know. I mean, we're still, when a child presents with certain conditions, let's say that they're wetting the bed, let's say they have a problem in school with being able to keep up, maybe they can't pay attention, they're hyperactive. We throw all kinds of things at it, addressing symptoms, but never really understanding what's behind that. And I found that to be just fascinating. So anyway, what I learned is that there are answers to these issues, and good answers for parents and children who are suffering in these ways. And that began sort of a little bit of a journey of discovery and a journey for me from a business standpoint, to where I realized that to address this problem, which was affecting millions and possibly tens of millions of children, and then their parents, their families, the adults in our society, I began to see the scope of this as being something that was just really large. And I felt like, this is going to take a lot of resources to address this. And so I came to this from the standpoint of wanting to figure out a way to get the word out and to help.
Yeah.
But it also evolved into, okay, this has to be a good business, and the business model has to work, or we're never going to be able to attract the resources to tackle it.
Yeah.
And so Vivos was born back in 2015, 2016. We got our technology act together. We had some really interesting oral appliance devices. And the interesting aspect about this journey for us is that it was never really about the technology or about the specific appliances. It was all about how we could help people and how we could help people the best. And so Vivos has emerged as a leading purveyor of therapies for all kinds of breathing and sleep disorders. And yet we're becoming, the further we go, the more agnostic we are about which oral appliance is best or which one does what or what it does. And yet we have some really amazing, unprecedented clearances from the FDA to treat.
Which is really interesting, Kirk, because one of the things that I observed as a practitioner before I become merged with the journey of Vivos was the amount of misinformation out there for both practitioners trying to tackle the disease of breathing disorder to the patients that are just merely suffering from symptoms and how their lives are impacted, from children to adults, from snoring to ADHD and all aspects of the health failing. And the FDA clearance was really just the tip of it, because a lot of people don't even know what appliance and what treatments are available for obstructive sleep apnea. And the mainstream treatment, as you and I know.
Yeah, so traditionally what dentistry has done, dentistry's contribution to the whole breathing airway thing is a technology that's been around for a long time. And it's just mandibular advancement. It's a mechanical repositioning of the lower jaw forward. And when you do that, you open up the airway that sits right behind the lower jaw. And as good as that is, as you know, because of what you've been through in your journey, right? As good as that is for some people in some instances, it's not right for everyone. And it doesn't really address the underlying issue. And that to me was always really strange, because I always felt like, why are we managing a disease? Why are we deploying techniques, whether it's a pharmaceutical solution, whether it's the traditional oral appliance solutions? Why are we so whether it's CPAP? Actually, CPAP is another tool to manage a disease state. And when I look at sleep medicine and I look at sleep dentistry, it's a series of different tools to manage a disease. But rarely is anybody talking about, how do we fix this?
And how do we prevent it from becoming a problem?
How do we prevent it? Yeah.
That's children.
Yeah, exactly.
That are still growing.
Exactly. You know, we came to the conclusion some time ago that there's really only 3 things that you can do for obstructive sleep apnea. And we'll use obstructive sleep apnea as a proxy for breathing and sleep disorders, right?
Yes.
Because it's the most commonly, people hear about OSA, they hear about obstructive sleep apnea. Many people don't realize that there's 1 billion people on planet Earth that have this condition. So it's everywhere, right?
Yeah.
There's 1 out of 7, 1 out of 8 people on planet Earth have one of these disorders. And but obstructive sleep apnea is a condition that we fail to really grasp the complexity of this whole thing. And I think when people think that it's just a simple thing like Uncle Bob snores and we're going to put his lower jaw a little bit further forward and he's going to be okay, and that's all we have to do. One of the things I've learned, and I've learned this from you and some of your other podcasts, you're going into this with Dr. Pearson and others, this is a complex disorder.
It's very complex.
It's very complex, and it requires a real thoughtful and informed approach to really understand. And so as we get further down the road with this, not only are we learning how to use the technology that we own here at Vivos better. For example, when we first launched this journey, average treatment time for patients was 24 to 30 months. I mean, it was you got committed to wear these oral appliances for 24 to 30 months before you'd really get the full measure of what we had. Now we're 10 months, 12 months. It's less than a year now. And a lot of that we owe to you and others who have pioneered protocols, really. Yeah. And some of them, non-dental protocols that have been synergistic with what the oral appliances can do. And so I guess when you think about, if you were to ask me, so what do you want people to know about Vivos? I want people to understand that this mission that we have is leading us down a path that for the first time in history, I think we're going to be able to resolve OSA for a lot of people. And we've already
it's a very big claim here, Kirk. Yeah. And I just think a lot of folks out there hearing this and they're rolling their eyes and thinking, how could anyone make that claim? Well, the only place that we can say we can cure something, and I don't like to use the word cure, but tackling a problem is acknowledging what it is.
Right.
I think if you don't know how giant the problem is or where it's coming from, you can't make that claim. But acknowledging that it's a complex problem is the first step in the right direction. Right. And we do that better than any place. And
really understanding what it is. If I believe that if I come to the table and I believe that the problem that my patient has is that his lower jaw is simply retruded and too far back. And that's the only thing going on with that individual. Then in my mind, I think, well, if I can just move his lower jaw forward, then I've got a solution. I've fixed the problem. I declare victory and I'm done. The truth is that there's a lot more to it than what I'm looking at, especially if I'm looking at it through the lens of my own education as a dentist, right? I'm looking at this and I'm going, okay, so if I understand the complexity, then I can understand that while I may have a part of the solution, I probably don't have all of it, and I need to collaborate, and I need to connect a lot of dots in order to make this all come together. So I think what's happening here at Vivos is, just for your audience here, I want everybody to know that Vivos, we play by the rules. We believe in evidence-based, research-backed science. We've always believed in that. We haven't always had the science to back up everything that we do, and we haven't had the science that explained to us adequately what was really going on. We knew early on that we were able to address this condition, and we had theories about what was going on and what was happening, but we didn't know why. And now we're learning why. Now we're learning what's happening, and as we learn more and more about the human body holistically, we learn more about connections that we'd never, who would have thought that the pelvis and the cranial bones and the cranial spinal fluid and all these things, that they were connected to our breathing, that our breathing was connected to that, and that dysfunctions in one area of our body affects the dysfunctions in other areas. All of these things coming together, it gives us a powerful
which explained
approach.
The one C that it was missing in the chain you mentioned. It is breathing disorder and obstructive sleep apnea is a complex disease.
Right.
And the patients take a lot of compensation at many levels, physiologically, orthopedically, neurologically, even mental, emotional aspects get a hit from this disease. And until we understand how to collaborate to decode the head-to-toe aspect of this condition, just like anything else, we will not be able to connect the dots.
Right.
And I think the admission of the complexities, what really is on our side as a company moving forward. And I really would like to mention this as a doctor who's been through this journey way longer than I have been with Vivos. And when I decided at 10-year mark in my career to become an airway to AMJ specialist dentist, I recognized very quickly that the problem is bigger than just an oral appliance. So my mission was to test everything. So I did. I went on a journey of trying every camp in dentistry.
You were gone for, every weekend. You were gone for 2 years, it seemed like.
And the more I learned, the less answers I was getting from a dental community.
Right.
And everything works for some certain percentage of people. But I'm more interested in what didn't work for those percentage that did not get the results. Where was their problem come from that we didn't acknowledge and we still have to address? And the burden was on me because, at some point you see things, you can't unsee it, you can't live with it. That stage of consciously being incompetent about what I didn't know took a 3-year journey for me to find out a lot of other providers that need to be a part of treatment for a patient. Hence why I claim 90% plus victory, almost close to 100% victory with almost any patient that walks through the door.
Yeah.
And I don't think anyone in their own inheritance, patients are not necessarily untreatable. I think we're dooming a lot of people to treatments that are basically life sentence. Let me say that. CPAP to me,
I want to make
sentence.
sure that for the benefit of those who may not be familiar with this, when you talk about being able to treat, you're talking about something very different than what most clinicians are talking about, right? So when a dentist says, "Well, I treat sleep apnea," what they really mean is,
I'm managing it.
I'm managing it for X number of patients, and
for X number of years.
For X number of years, and they're not really getting better. Although I'm giving them an opportunity to live to fight another day. They're having to wear these devices every night for life. If they're in a CPAP, they're wearing them every night for life. When we talk at Vivos about treating OSA, we're treating the fundamental root cause that we're trying to address, and we're trying to correct. And when we correct that, And when we collaborate with our fellow colleagues who are also on this journey with us, we actually can evoke some changes here that can last and can actually resolve it without the need for lifelong intervention.
Correct.
So it's not we're going to hand somebody an oral device or any kind of a machine, a CPAP machine or whatever. We're not going to give that to them and say, wear this for the rest of your life and you'll be better. We're saying, hey, if you really want to get well, here's a pathway that for a lot of our patients results in a resolution of your OSA.
And really the definition that I want to put out there for people that might have reservation about what we were talking about.
Right.
I'm speaking from a clinician standpoint who have seen patients as young as 2 years old as 89 years old. I've had the most giant human on earth that I've treated.
Yeah.
And I've had small women that has otherwise did not have all the phenotypes, prototypes, typical OSA patients. I've treated everyone in between to narrow it down to one thing. The fact of the matter is every person have their own journey in their disease processes. And we catch them somewhere in that process, in that spectrum. And without knowing their story and how they got there and how their body responded to be dysfunctional, all we are doing was what you just said, managing symptoms. Hence, I keep going back somewhere in the episode, every episode, I'm going to have to reiterate why I was passionate about the title of this podcast.
Right.
Because what we call managing symptoms is not a treatment.
Right.
It's what it is. We are buying them another day. We're managing their symptoms, but they have to depend on medications and machineries and devices. And if they do not have the same quality of life without that intervention, then that's not a treatment really.
Right.
Treatment is getting them from one state to a closer to homeostasis. And the modalities that we do and our therapies are aimed at gaining more perspective for that individual to get closer to homeostasis, whatever their journey is. And that's improvement. We're not saying that everyone's metrics are going to say, no, they're completely 100% treated. I've had patients that they had their AHI, which is the metric of OSA severity, upwards of 60 and 40 every night, and I brought them down to, with the team of doctors I work with, down to 10. Well, by definition, that patient's gone 2 categories down. Now, can we say they're completely cured? I don't know if I can necessarily attach a title to any of this, but the patient is living without a CPAP.
Right.
They can actually be a productive member of society, and many other aspects of their life got affected.
Incredible improvement.
100%.
Incredible improvement.
So to me, that's creating health. Now, and one thing I'm really passionate about is just what we really call health in the presence of symptoms managed is really not health, is turning off the nervous system or frontal cortex of our brain to not know about it. It's like taking out the car check engine light without addressing why it turned on. Okay? You know, you could do that, but the car still is not running properly. And what I really want everyone to learn about, why I chose this platform, why I chose the system, and why I'm here chanting, and I want everyone to hear about it is.
Well, part of your journey, let's just lay it out there. Part of your journey was you went and you tried a lot of other oral appliances.
Yep.
You tried a lot of other techniques.
Yes.
I mean, I stood on the sidelines and I watched you go through, and you were not always the biggest Vivos fan, right?
Oh, no.
You were, until you had tasted the other sort of, you know, the other opportunities that were out there, and then you came back and you said, you know what, I think that what you guys have here is foundationally and fundamentally.
It's a centerpiece to the game that I'm playing, and what I really like.
And if we find something, you and I have talked about this. If we find something out there that's better, or we find something out there that's the next level, man, we're all over it. And we're, because our mission, again, is not to promote any type of, you know, oral appliance device per se. It's to get people well. And if we can find another way, a new way, a better way, we're all over that. Yeah. And right now, what we've found is, for the first time in history, with the work that you've done, the work that Dr. Pearson's done, the work that others have done here at Vivos, we found that we are closing in on being able to resolve this condition for many, many, many people.
Yes.
Now, we can't make claims to cures. We can't make claims to anything, but we are improving the lives and the quality of life. And we're now in the stage of of making sure that we can back that up with science. So we're putting the research in place, we're performing the studies, and we have the support from some of the greatest people in this industry, from Stanford University and other places. Dr. Kushida heads up our clinical advisory board. We just have some of the brightest minds and the best people that are seeing the data, seeing the results. Dr. Kushida told me recently, Kirk, the reason that I love Vivos, the reason I'm here is because I love the data. The data is so powerful, and I think it's pointing in the right direction, and I see what you guys are doing, and I want to be a part of that.
And it's ever evolving, Kirk.
It
and
is.
The fact is, science is what it is. If it was one and done, we would never be here having this conversation and being a part of a journey that I have observed in dentistry. Much of what has been put out there for dentists to do for treating or managing, as we discussed, managing obstructive sleep apnea, not much has changed in the last 100 years. Nothing has changed. It's either a rapid expansion for treating children and now they're having surgical techniques for adults, or mandibular advancement, or per se cutting soft tissues, or medication at this point.
And this is what I love about our approach. It's non-surgical, non-pharmaceutical.
Absolutely.
For people who don't want to undergo surgical procedures, for people who don't want to engage in a lifetime of interventive therapies, man, I think Vivos offers a really viable third. And, it was great last November when the FDA acknowledged that finally and said, yeah, the data is compelling here. We're going to give you the first clearance for any oral device to treat severe patients. So you can treat mild, moderate, and severe. That was a huge breakthrough.
And that was an acknowledgement on the part of FDA that the interdisciplinary approach is what's really getting the patient across the finish line for most. And again, going back to data and validity, is that we acknowledge the complexity and that we are bound to a system that knows how to adapt and survive, and putting the research in there. And I think what really sets this story differently for me as a practitioner is, if you're not searching for new ways and improving and going back and saying what failed, all we're doing is repeating the same and claiming victory.
Right.
And I don't think that any one treatment is going to treat 100% of patients ever. There is no such a thing. But we can for sure say one thing, and every patient that I take on, my first conversation with them is, you need to know what your goals are for your health.
Yeah.
And if you can't put your finger on it and how it can make your life better, I don't think any doctor can help you, that's for sure. But more important, I think understanding what it is that our patients are struggling with and where their bodies are taking their quality of life down, and bringing the right team to get them to a better stage of homeostasis is really the goal, truly the health, not managing it, not band-aiding it, but more so for children, because we are really huge about children's treatment, and we are ever evolving, finding what's best. And my hope and mission is that within the next few years that we are completely abandoning some of them old traditional ways that basically it's just yet another Band-Aid, because I've seen those kids as adults in my chair. Mm-hmm. If those systems worked, why are they still suffering from the same condition as adults and relapsed? And we have never answered that question. Unfortunately, my profession has been unable to move through the field of medicine fast enough to get those answers to people like me. So I had to become my own, go on my own quest to find the answers I never got in school, and find out who else should have been here, who else should have been a part of the journey for my patients, and putting those teams together, and now bringing all of that into and echoing that on one of the biggest stages I have ever been on in our industry here at Vivos, and inviting other professionals to work with my colleagues, because honestly, I think dentists are one of the most key people in the journey of the patient's health, and we have some of the best oral appliances that are continuously getting more refined. I'm personally in touch with that refinement process. Is just a joy to watch what we can do as dentists, what our role really is, and not taking just push their jaw forward and they'll be better. I just don't buy that anymore, and never did, but not with conviction and pushing that needle. So I'm really thrilled, first of all, that your entrepreneurial spirit, piqued your interest to create this platform, because I'll tell you what, Kirk, that's just my journey. I don't think that I would have been this far 5 years into the journey of being an airway dentist. I would have been this far have I not been here?
Well, we've made a lot of progress, and we've made a lot of progress together.
Yeah.
I think there's so much more that we can do. I smile sometimes when I see these advertisements on television where they're insulting, the people that are on CPAP. Hey, CPAP is the very best thing that medicine has had for the last 40 years or whatever. And the medical profession has given patients the very best that they could. But now there's really no excuse for a provider or a patient to not seek out the additional pathways in their journey that can lead them to a more robust, more complete resolution of their condition and a better place of this, as you mentioned, the homeostasis, the full health and wellness that's possible is now here, and it's here today, and it's getting better all the time, and our success rates continue to improve as we learn how to use this amazing technology in collaboration with medical doctors and chiropractors and dentists and all the other disciplines that are necessary to make this happen. But this collaboration is yielding some amazing results, and I'm so excited for what the future holds. I'm thrilled to be here as part of your podcast today. I think there's a lot to go here.
Again, I've been having my head in research and practice for way too long, and I've seen this happen in front of me not once, hundreds of times. And I thought this is a great time in the history for me to bring this up to people that deserve it the most. Because, Kirk, if I only got a dime every time I heard this in a chair with a patient, that I've been dealing with the obstructive sleep apnea, breathing disorder, all the other modalities that has failed them, and how their bodies and their life has fallen apart because really there hasn't been much research into even offering them oral appliance therapy as an option. And they're sitting in my chair saying 3 decades of me, gone through multitude of surgeries, have been on CPAP several years, and I still cannot tolerate it. And now I'm hearing about this, and I've had treated those patients successfully.
Some of these patients have been dealing with this their entire life.
Their entire life.
And there's without any good answers. And that's, I guess, if there was one thing that I would leave your audience with today, if somebody were to say to me, so what does Vivos bring to the table, right? Yeah. And I think that word is hope.
Hope it is.
Hope. Because, look, we're not making any wild-eyed claims that we can cure cancer or do any of this stuff. What we can bring to patients who've been searching sometimes their entire lives for answers and solutions, there's hope now. There's hope. We're within striking distance of being able to make some really, really big changes because, as you know, breathing and sleep disorders affect every other body system, our endocrine system, our cardiovascular system, our digestions, our hormones. I mean, you can go up and down. And so when we correct this is foundational. And when we correct this, we affect so many things downstream.
It's just really interesting, Kirk. Yeah. The first time I got introduced to Vivos and I saw the tagline of Breathe New Life.
Right.
And then I see that we're dealing with OSA. And one thing that really got me stuck here, and I never left, is that we're not dealing with the root source of the OSA, which is breathing disorder.
Right.
And we don't claim to treat OSA or asthma or all the other things. I think our goal is to make patients breathe better. We'll let those things take care of themselves.
Exactly.
Because if you can breathe better when you're standing, when you're sitting, and when you're going through life, you carry that to tonight. And we are going through fluid life and carrying the experiences. And our goal is to make the patient breathe 24/7 better, not just caring about the 8 hours.
Well, a perfect example of that is you mentioned that we treat children. Well, we're not really treating the OSA in these children. What we're doing is we're helping Mother Nature through our guided growth and development techniques. We're helping Mother Nature develop that child to their best genetic potential, whatever their phenotype is. We're helping that patient sort of develop their jaws, develop their oral cavity, develop their airway in a way that is natural and normal, and once they have that,
their body goes from survival to thriving.
To thriving. I was just going to use that word. It's thriving. Exactly right.
So everything gets impacted. Their performance in school, their walking patterns and facial structures, and their teeth.
And throughout their life.
Not having crooked teeth.
Yes,
who doesn't want that?
Totally.
Well, Kirk, I'm overjoyed that we got to do this, put this message out there. I'm pretty sure we're going to do another episodes here, but I'm really thrilled. Thank you for everyone tuning in today. listening to our conversations, and hopefully you walked away with a little bit more information about the obstructive sleep apnea, breathing disorder, and what we do at Vivos best to address that as a whole. Thank you so much for tuning in. Stay healthy.
Thank you.